Here you can see the direct inclination screen. The panel on the right is the patient records panel. Each name here is the name of a patient that the direct inclination is or will be caring for today. The symbol of a bed next to a patient's name means that there is a tech with them in the home. If this symbol is a car, it means that the tech is on their way to the patient's home. As you can see, there are already several alerts coming in from technicians in the home. Yellow alerts are normal notifications such as completed reports and instructions. Gray alerts mean I have sent an instruction that has not yet been completed. Brown alerts with word bubbles mean the tech with that patient has sent me a chat message. And red alerts are urgent notifications that demand immediate attention. Let's begin directing a patient. Under the Direct tab, we see the tools that the direct inclination uses to direct technicians in the home. The first sub-tab, Visit Details, will display visit information as it comes in from the tech in the home, while the remaining sub-tabs are Instructions, Clinical Notes, Visit Tasks, Review and End Visit, and Chat with the tech in the home. Now let's switch over to the tech view and begin a visit. Here you can see the mobile version for the technician at the patient's home. We are a tech that has just arrived at our patient's home. After logging into eShift mobile web, we open our patient list, select our patient, and tap the Open Patient Record button. Select Supervised Visit to start our visit. A geolocator then pinpoints our location so that when we select Start Supervised Visit, our location information is sent to our direct inclination to verify that we are in the correct location. Now our visit has begun. Immediately, we are prompted to complete predefined report tasks by an alert in the top right corner. When we select this alert icon, we see a list of reports to be completed. These initial reports are designed to provide the direct inclination with an initial sketch of the patient's current state and environmental context, as well as key indicators that allow tracking of the patient's progress or decline. They are fully configurable to allow tailoring to the needs and requirements of the specific patient population being visited. I can also send a short chat message to my direct inclination apologizing for being a few minutes late. Let's start with the first predefined report, Initial Indicators. Forms can be filled in by selecting New Answer using either touchscreen functionality or by clicking with the mouse. I will now go through this form and select appropriate responses. The Initial Indicators report includes vital signs and a few other key measures for this population. Now that we have completed our first task as a technician, let's switch to the direct inclination to see how this information was received on their end. As you can see, next to the patient's name, there are several notification alerts sent from the tech, and we can now review the forms that the tech has just sent. Here I see the information that was just sent by the tech, which I have not reviewed yet. In the Start Visit Details, I can see if my tech is in fact at the patient's home. I check off items as I review them. This adds them to the visit history and removes their notifications in the sidebar. After reviewing the Initial Indicators report, the direct inclination may want to understand this information in historical context. I can go to the Dash tab and look at the historical graph for this report. Here we can see graphically the information sent by various tags over time, and it is a visual representation of the dynamics of the patient's condition. Let's imagine that the initial indicators show that the respiratory rate is higher than normal and there is a cough, but the heart rate and blood saturation are normal. We'll want a little more information to rule out the onset of exacerbation. Since I have concerns about the patient's condition, I will now begin a video conference to speak with the patient to assess the changes in their condition. To do that, I will open the chat room subtab on the left side panel and click Open Video Room. This alerts the tag that the conference room is open. To start the video conference, I will click Join Conference, and when the screen that reads "Please wait for the host to start the meeting" appears, I will click the login link. I will then log in by entering my email address and password and click Sign In. Finally, I will click the Join with Computer Audio button to start the video conference. Once I've spoken with the patient and evaluated the situation, I will finish the video conference by clicking End Meeting and then End Meeting for All. I will also request more details from the tech by instructing them to complete a COPD report. To send an instruction, the direct inclination returns to the Direct tab and clicks the Visit Instructions subtab. There are three types of instructions: a general free-form instruction, an instruction for the completion of a specific report, and a med administration instruction. Let's have our tech complete a COPD-specific report. We select Report, then the COPD report. Then we click Send. Now let's go back to our tech view.
Back on the tech side, I see that I have a notification to do a COPD assessment. The tech first accepts the instruction, which lets the directing clinician know that they plan to do it. If it cannot be done or requires more information, they reject it, but provide the reason for rejecting. To perform the instruction, the tech taps the Complete Form button, which brings up the specified form to complete, which we'll do now. Back on the directing clinician side, upon reviewing this information, we see that the patient has not been using their rescue inhaler. They have a dry cough, not a wet cough, and they are having difficulty with inhaler use. From this, we rule out the onset of an exacerbation. This seems to be an education issue. Let's instruct the tech to have the patient use their rescue inhaler and educate them on inhaler use. We go back to our instruction menu and provide our tech with an instruction for inhaled Advair. In the comments we enter, please use the instructions to guide the patient through administering the rescue inhaler, and then go over the inhaler educational materials. On the tech side, the tech accepts this and is prompted to follow the procedure-based checklist. These instructions are fully customizable, as are all forms, to reflect local best practices. On this Med admin form, you can see there is a prescriptive checklist that I need to check off. As the tech, I would go through these with the patient and then send. After completing this task, I as the tech would finish the task that I left and review the care plan for any actions assigned to me. When we come to the end of the visit, the technician sends a chat message to the directing clinician to make sure there is nothing else required of them before they leave. The nurse then checks the Visit Tasks sub-tab to ensure that all the tasks are complete, and then lets the tech know that they can depart. The tech then departs, and the directing clinician ends the visit on their end.